as well as the other partner agency here locally, which will be Flagler Health. Flagler Health is committed to also doing the same as the Department of Health under a prescription order as well. Many of you know now that there's also a regional site that's been set up in Duval County. There originally were some restrictions on being able to go to that site. Many of those restrictions have been lifted. Now any and all age ranges can be tested at that site location. We've also been asked a number of times, what about additional site locations? Duval County and some of the other larger counties in the state have set up additional site testing locations. We've been in touch with a number of private entities who have offered up additional sites. As you can imagine, though, there is a major constraint on our health department, on the nursing community, on the health community. So the major concern with doing additional site testings currently within St. Johns County is having the staffing to support that. I do want to give you an update on what St. Johns County is doing in response to COVID-19. First of all, the St. Johns County Board of County Commissioners declared a local state of emergency on March 17th. That declaration was reinstated today, providing the county continued access to FEMA, resources necessary for the current and potential impacts of COVID-19 within our community. That declaration will extend for another 7 days and will continue to be monitored by the Board of County Commissioners and reviewed as we continue to work through this together. In regards to our Emergency Operations Center, we've been elevated to a Level 2 partial activation to assist in the response. What does that mean? We've opened a citizens information hotline for St. Johns County regarding facility closures, program cancellation, and COVID-19 updates. The hotline is active between 8 a.m. and 6 p.m. 7 days a week. The number to reach is 904-824-5550. I want to repeat that one more time. This hotline is open to all members of the community regarding facility closures, program cancellations, and COVID-19 updates. That phone number is 904-824-5550. In regards to county operations, for the health, safety, and welfare of our community, we have put in a number of additional measures. First of all, the St. Augustine Amphitheater, the Ponte Vedra Concert Hall, St. Johns County Public Libraries, and recreational program and facilities will remain closed through April 17th. All other St. John County facilities operating under limited public access restrictions through April 17th. These include the closures of some public lobbies, the encouragement of online business practices, and the reduction of building occupancies. All departments are working to maintain a high level of service during this time through phone conferencing, emails, and online registrations. Public meetings are now having the opportunity to use telephone and video conferencing as outlined in the governor's order, as well as the emergency order that was signed today by the St. Johns County Board of County Commissioners. I want to emphasize here the importance of maintaining these operations, why we're trying to keep those public buildings limited for public access. First of all, we want to make sure that we're doing everything within our power and our ability to limit and protect the public safety, health, and welfare of our community. But it's also important to know that when this is over, there are many businesses, there's many cashiers, waitresses, clerks, yardmen, construction workers that are going to have to pick up the pieces and go back to work. And so as long as we have the opportunity, and while we're listening to the Department of Health and monitoring the situation here on the ground daily, we do want to try to continue to keep business running as usual, as normal as possible, and what I would consider a new normal. I think this is a new normal for all of us. None of us have experienced this before. As you look around the state, the county, the country, and the world, this is a totally different time than anything we've faced before. So while we can, we do want to continue to allow business to operate. It's not as normal as possible and as usual as possible, but it is the best we can do for now. I want to add the Sunshine Bus Company is now restricting the number of occupants to 10 per vehicle and requiring patrons to maintain a 6-foot distance from other passengers. For small local businesses feeling the impact from COVID-19, the Florida Department of Economic Opportunity will provide short-term interest-free loans up to $50,000. I would like to thank the St. Johns County Chamber of Commerce. They have been working hand in hand with us as we moved through this. They are providing information to the local business community. As we get information, we're pushing that to them, and they're pushing that out. I want to talk about the beaches. I know that that's a major topic. Many of you probably have questions about that. Many of our constituents have questions about that. and that's probably the primary issue that we've heard about over the last few days. As you know, last week we took the stance and we were wide open at our beaches. So there was no restrictions on the beaches at that time. We were listening to our Department of Health and other medical officials here locally. We were listening to first responders, our law enforcement agencies that were on the ground, and we made a decision at that point to leave our beaches open. Then on Friday, as we continued to assess as other communities around the state began to close down their beaches, we then began to see the influx of people, spring breakers, tourists, people from outside of the state, all around the country and around the community coming into St. Johns County beaches. The hope was to continue to maintain the posture. We've been told, and I think Dr. Allicott will support this when she comes up to speak, we've been told that it's good for our mental health to be outside, to be able to go out for a walk, to be able to converse where possible, so long as you're following the CDC guidelines. However, we began to see such a large influx, we knew that we'd have to take some additional measures. So at that point, on Saturday or Friday, whenever it was, we made a decision to access or to restrict vehicular traffic. The hope was that by restricting vehicular access, we'd be able to limit some of the patrons and people using the beaches while continuing to keep St. Johns County community and residents safe. Unfortunately, we continue to see an overwhelming number of individuals that were using the beaches continue to come. Additionally, our sister county to the south and our counties to the north of us also closed their beaches. While we don't have to do everything that every other county does, we do have to be considerate of the pressure that it may put on us. So in response to listening to our Department of Health, listening to our law enforcement officials who were on the ground and were responding to the people that were on the ground, we made a decision to further restrict it. We've heard a lot of questions, why not close the beaches down completely? Other counties are doing it. What I'd like to go back to for that question is, if you think about what the president has said and what the governor has said, all of these decisions have been made. No one yet has made sweeping changes across the country for a lot of different things. The president said we're going to leave that to the governors. You've heard of a number of shelter-in-places from multiple governors across the state. Governor DeSantis has said at this point he doesn't intend to do that. Certainly that may change. And then you heard Governor DeSantis, he's spoken on multiple press conferences. We want to allow multiple communities and each community to make their own decisions with regard to public beaches. We certainly respect and support the decision of other counties that have made that decision, but here in St. Johns County, we want to do what we believe is best for our community, what's best for the residents, while allowing people to continue to access public spaces. I want to add to that, we've taken the same approach to that we also took with our public parks. So our parks are restricted for private permitting for large public gatherings, but you can still go to our parks. You're still able to walk through, go out for a walk, kick the soccer ball with your kids. The reason we've taken this approach, like everything we've done thus far, is we want to make sure that we're methodical and deliberate in every decision we make. We don't want to be sweeping, we don't want to overreact, and we don't want to have emotional knee-jerk responses. We want to make sure what we're doing meets the needs of our community. And I know that each and every other county official throughout the state and throughout the country is doing the same thing for their community. Before taking any questions, I do want to just give you a couple more pieces of information, and then I'm also going to turn it over to Dr. Allicott to provide you some more medical updates. We'd encourage you to continue to follow basic prevention guidelines, including washing hands often, avoiding contact with the sick, cleaning high-touch surfaces, and staying home when sick. Basically, these are the CDC guidelines that everyone listening, everyone here today has heard over and over and over again for the past several months. We want to repeat that. I've driven all over the county. I've seen businesses throughout the county. It appears, this is not by data, this is by just personal observation, people are taking personal responsibility. People are separating themselves, people are maintaining their distances, people are doing what they can to support the community while observing these guidelines. As a county, we're going to continue to follow these CDC guidelines by limiting gatherings to no larger than 10 people and maintaining a social distance of 6 feet or more. We'll also continue to work with our local health and first responder partners to address the development of COVID-19 in our community. I'd point your direction if you need any more additional information regarding St. Johns County facility closures, program cancellation, and COVID-19 update. Please call the Citizens Information Hotline. That number one more time is 904-824-5550. Additionally, on our website at St. Johns County, Florida, SJCFL.us, We have a dedicated COVID-19 page. You can click on there for any information as we continually to push out information to our community daily. As an additional resource, the Florida Department of Health call center can be reached at 1-866-799-6121, and their website is www.floridahealth.gov. Questions can be submitted to them at COVID-19@floridahealth.gov. Dr. Alicock is here to provide an update, and as soon as she's done, we'll take any questions.
Greetings. As the Director, Health Officer, and Medical Director with the Florida Department of Health in St. Johns County, thanks for the opportunity to share the Florida Department of Health's COVID-19 response, which encompasses the following 5 priorities. 1, stopping the introduction and disrupting the spread of the virus into the community. Number 2, protecting our vulnerable elderly population. 3, continuing to support the increase in testing. 4, working with our hospitals and emergency management to prepare for any needed medical surge. And 5, reinforcing messaging around social distancing. To stop or slow the spread of disease, the Department of Health over the last few months conducted active monitoring of travelers and high-risk individuals to ensure they stayed in self-isolation during their communicable period, such as those who traveled back from China. Through contact tracing during an epidemiological investigation, the Department of Health will isolate a patient who tests positive for COVID-19 and determine the patient's travel history and with whom they may have had close contact when sick. People who have been exposed would be notified and may be isolated and observed for symptoms of COVID-19. To date, as Mr. Conrad shared, there are in St. Johns County 22 confirmed cases and 1 death. This individual was a contact to a confirmed case, and there was a history of travel. Our hearts do go out to that family. It is therefore of the utmost importance that we continue to protect our vulnerable elderly population. St. Johns County Emergency Management began calling our long-term care facilities to assess their needs. Currently, the Department of Health is calling every day to ensure that these facilities are following all of the most recent Centers for Disease Control and Prevention's guidance on visitation, social isolation, and environmental sanitation, and to ensure we know if any residents or staff have influenza-like illness types of symptoms or any COVID-19 concerns. If there are any COVID-19 concerns, the Department of Health follows up to ensure testing is done and that contact investigations are started as appropriate to limit any spread of COVID-19. Regarding testing, I reiterate as Mr. Conrad shared, the Florida Department of Health in St. Johns County and Flagler Hospital are both collection locations for COVID-19 specimens for testing. The Health Department is designated as a collection location for those individuals who are generally a part of a contact investigation and do not need to be seen by an emergency room or urgent care center. We have loaned our mobile medical clinic, our public health mobile center, to Flagler Hospital to assist in their drive-through collection site. I humbly leave you with one key action that we as St. Johns County residents can do, and that is to follow the common sense measures that the Board of County Commissioners, city leaders, and first responders have implemented to ensure that we're all practicing social distancing. In other words, not congregating in groups more than 10 and keeping 6 feet from those around you. And it would be remiss of me if I didn't leave you with a public health message. I encourage each of us here this afternoon to wash our hands frequently with soap and water for at least 20 seconds. If you cannot wash your hands with soap and water, then please use a hand sanitizer that at a minimum has at least 60% alcohol. Do not touch your face, your nose, your eyes. I have a temptation to do that, I can't help it. And cough into your arm or tissue. And if you use a tissue, kindly discard the tissue after using it and then wash your hands. Further, please stay home when you're sick. Thank you.
Are any questions for myself, Dr. Allicock, or Ms. Stoughton, our Emergency Management Director? Yes, ma'am.
Mr. Conrad, Janice Harris with Channel 4. What specifically are the new restrictions for beaches?
Specifically, is there's no vehicular traffic and our public parking lots are closed. So it is open to pedestrian traffic. If you live on the beach, if you know someone who lives on the beach, you know someone close by, or you know an area where you're able to park, but public parking lots and vehicular traffic are closed at this time.
Can people arrive
Yes, sir.
by bicycle? Sorry, Jeff Allen, FirstCoast News. Can people arrive by bicycle and do their bikes in the parking lot?
At this time, there's no restrictions on bicycle traffic, but the parking lots are closed, so they would not be able to leave their bikes in the public parking lots.
Are you doing?
Yes, ma'am.
What are you doing to protect first responders?
So first responders have been given all the necessary PPE equipment. I can bring Chief Pravat up to discuss some of that, but they've been given the PPE equipment as they need. Ms. Stoughton, through Emergency Management, has been working with the Florida Department of Emergency Management in order to provide all of the necessary equipment that they need. And then obviously, if they come in contact with a case, they'll be going through the Department of Health to make sure that they're tested immediately.
Mr. Conrad,
Yes, ma'am.
we've had viewers reach out to us and say for the beaches to remain open in this county as opposed to being closed in other counties is considered negligent at this point because we really don't know how many people actually have this virus. What do you say to the people of St. Johns County that express that concern?
Sure. What I would say to the people who are worried about that or concerned is what we're doing is making sure with local law enforcement that those guidelines are in place. So the information that we get comes directly from the boots on the ground who are out there. The information as of today that I'm being given is that people are respecting that distancing. You can break it up into a couple things. First of all, limiting vehicular traffic has slowed down a lot of people on the beaches. It slows down the congregating of people within vehicles. Then public parking lots also being restricted. As you can imagine, inside of a public parking lot, there are lots of people in confined spaces that are trying to access the beach. So by doing this, we've limited a large number of people coming in and out, and it's helped to maintain that social distancing that the CDC guidelines have prevented. One of the things I'll add to that is, we're constantly monitoring, constantly evaluating. We've drawn no lines in the sand on anything we've done. We continue to want to be methodical and deliberate in every step that we take, and we're listening to local law enforcement officials who are out there monitoring the situation each and every day.
Are you concerned
Yes, ma'am.
about people parking on just sides of roads instead of the public parking lots?
Again, an enforcement action. We've not heard that from local law enforcement. We're continuing to listen to them from the St. Johns County Sheriff's Office, as well as the City of St. Augustine Beach and their law enforcement officials. At this point, that has not been a significant concern that we've heard as of today, but we continue to be open ears and open eyes and to listen to those officials on the ground. Yes, sir.
Can you elaborate about the death? Use the phrase contact confirmed, and also there's been talk that this person was up in the coastal Oaks area of Nocatee, perhaps. Can you?
Sure, I can't elaborate on that. I'll turn that over to Dr. Allicock if she's able to provide any more information on that.
And the question?
And just if you can elaborate on that one death, there's been talk that the person was in the coastal Oaks area of Nocatee, and also that I think you used the phrase contact confirmed. Just wondering if you can elaborate on any of that.
Okay. The gentleman is a 52-year-old. I'm unable to share location. However, it appears that he was a contact to someone who had COVID-19, and also there is travel history. Thank you.
Doctor, I have a question as well. Philip with FirstCoast News. Just a question, because I know we're always just getting these things on social media with, I guess, like a lot of people saying that this is quote unquote an elderly disease, or like it's just affected mostly elderly, which we know that's not true. Just kind of information that you can give to us, like say for instance, if we are the ones who are considered to be well, how can we also look out for others who may have like some type of undergoing like chronic illness or something? How can we also protect them? Because those are our loved ones as well. We want to look out for them. So how can the general public look out for their loved ones who may be concerned about COVID?
I understand that question. I mean, I feel the same way about my family and my loved ones. The reality is what we saw initially was that we had the vulnerable elderly, anybody 60 or 65 and over, succumbing more readily to the disease. When they do, they tend to have pre-existing conditions that make them more susceptible. And then we see in that particular age group more situations where we have individuals who pass away, unfortunately. But we're also seeing, we see about 40% that are 60 and 65 years older succumbing to the disease, but we're also seeing the disease is affecting younger individuals as well. So that, of course, is a concern. The reality is that as young people sometimes, and I'm not young, so I'm not pointing to myself, but as a young person, we sometimes don't recognize that even if we may fare well, in that the virus might infect us, while we may not show the symptoms, we go back home to our elderly parents or to those who are older, and definitely the impact is greater in the older individuals. However, we are seeing it in a younger age group, about 40% 60 to 65 over. That means we have about 60% less than 60 years old. So we are looking at that. I think we have to understand this is a disease that is still evolving. The information is still unknown. We're learning more every day. At the Florida Department of Health, we're attempting as much as possible to follow the science, and I'm pretty sure we're going to know more as the days on go forward.
Dr. Yellowcott, has there been a pattern at all? Because I know the age range is broad, so it's 21 to 76 years of age. Has there been any pattern as far as where all of these people are contracting COVID-19?
I think for St. Johns County, as we get more cases, we'll have a better idea of how to respond to that question. At this point, with the investigation still ongoing, with the fact I know 22 sounds like a lot, it is. However, those investigations are still ongoing, so it's difficult to give you that information from a scientific standpoint.
And are
We should
any in
know
critical
more.
condition?
You know, if you have an elderly person in the hospital, it's difficult to say it's not critical. And other information probably is not available at this time, or that I'm aware of.
So here's a good question, FirstCoast.tv. So my sister works in New York at Precinct 11, Midtown Manhattan, and the hospitals around that area, lots of people are outside. It was raining yesterday. So my question is, to keep it simple, I suddenly feel like I have symptoms that are similar to the virus. So do I write it at home? Do I wait for the symptoms to get worse? Do I call 911? Do I drive myself to emergency? What should I do first?
I guess a couple of things. One, I would ask that person if COVID-19 did not exist, what exactly would that individual do? So for example, we still are surrounded by flu, by the flu situation we have every time, we still have all the other chronic illnesses
Right.
or acute situations. So we ask that if you have any concern at all, you put a call into your primary care provider before arriving there. If you have a concern at all before going to the emergency room, to put a call into them. If you're going to call EMS, to make sure you let them be aware that maybe you may have been exposed, so they can be appropriately use personal protective equipment. Call your health department, because we want the opportunity to be able to work through it with you. Often we find that when we've talked with the individual, some of it, we have the word well, and that is still a concern, because the reality is that alone, to sit home and worry about it for 18 hours is much better. You call and we sit and we work it through with you. The reality is resources are scarce. We're a lean agency. We are available 24/7, but we attempt to work through each individual. So anybody who has a concern, doesn't make sense just sitting home and waiting to determine. We'd ask you to give us a call. Let us help you work through the situation.
All right.
Doctor, we're having a lot of hot, sunny weather, just like right now. Can you identify any particular weather situation or circumstance that in and of itself is more conducive to transmission of COVID? In other words, on rainy days, is it more likely to get passed by people walking by each other?
I
Sunny days,
have no idea. I
Okay.
haven't heard much from social media, but again, scientifically, I have no such information.
Thank you.
Apologize.
For the testing site, I'm sorry, I have a question. The two testing sites in the county, I know people need a doctor's note, but can they go up to either of them and then get assessed there? I've kind of heard different
Okay, I
information.
can't
about
really
that.
answer for Flagler Hospital, but I believe what I understood about a week ago is that there is some assistance from an ND there. In the case with the health department, we are particularly concerned about healthcare workers. We're very concerned about our first responders. And so we do I'm the medical director, so the nurse does a type of nurse assessment, and then we determine from that whether that person really needs to be evaluated in a doctor's office or by telehealth or something of that nature, or whether we can go ahead and have testing. Then I'll approve testing. But we have strict guidelines from the Centers of Disease Control that requires us to follow the specific guidance that allows us to send specimens to the state lab, and that's where our specimens go this time.
So would they need to call a doctor before they came to the Department of Health?
They would call their doctor,
Okay.
perhaps we'll get a call from their doctor,
Mhm.
or they might call or on call, and they will speak to the nurse, and then we'll have a communication
Okay.
with them as to what happens next.
And if someone does not have a doctor, because a lot of people have no insurance, would they go to emergency in a hospital or?
We prefer you not to. If we believe we've been exposed, the idea is not to expose others. If our first responders or our healthcare workers go down, we're in a lot of trouble. So we ask you to make the phone calls. Obviously, if it's a 911 situation, if somebody thinks they're having a cardiac arrest situation or having a heart attack or something, of course we call 911. But I would ask you to make sure you share with those individuals that perhaps you might have had an exposure or concern about an exposure to COVID-19 so they can particularly take care of themselves before getting there. But if you call us, we will attempt to assist you in whatever way we can. Thank you.
Let me just conclude with this today. There's three things that I really want our community to hear, and for those of us that are here today as well. Number one, I think it's important that we support our local economy. If at all possible, for those of you that are here in St. Johns County or those that are listening in their own counties, go through the drive-thrus. Go through those places that need you. You're not just supporting that business owner that owns either that franchise or local restaurant or local area. You're also supporting the cashier. You're supporting the clerk, you're supporting the waitress, you're supporting the person in the back that's cleaning the dishes. Anything you can do, we're all in this together. These are difficult times. There are a lot of people who are struggling right now. So if you can, do what you can to support those around you in need. The second thing I would say is stay calm. There are a lot of people who are fearful. There's a lot of information out there. All of us are receiving so much information and an information download right now. What goes a long ways for a lot of people is a smiling face and a calm demeanor, especially if you're one of the people who tends to be calm or you tend to be not as concerned. Don't take that not to be considerate of others, but be calm, smile. That tends to go a long ways with a lot of people. And then the third thing, and I'll conclude with this, is that I would ask for you to pray. Pray for the people that are on the first lines. We could all use it right now, but specifically our first responders, our law enforcement officials, our healthcare workers. They're the ones who need it the most right now. So be in prayer for them, be in prayer for their families, and be in prayer for one another. Thank you all, and God bless you all.